And here we are at 725 News Talk 1590 KVTA. Dr. Marc Beaghler, good morning. How are you?
Good morning. Good, thank you.
Well, thanks for making some time to get in here. I know you guys, as far as scheduling goes, it's pretty difficult out there. Today we are talking about robotic surgery at CMH. Where would you like to start?
Well, I'd just like to, let the people know in Ventura County that we have a very robust program that we started over 10 years ago, and really it was the first robotics program between Los Angeles and San Francisco, and over the last several years the program has continued to grow and expand, and really it is a nice service for the people of the county of Ventura.
When you look at robotic surgery, give us an idea, like R2-D2 going there doing all the work, surgeon assisted. What is robotic surgery?
Well, robotic surgery really is using instruments that are placed in the patient laparoscopically, using high-powered magnification with very intricate instrumentation that is completely controlled by the surgeon. The surgeon is not necessarily at the bedside of the patient. He's at a operating console, and he's operating the instrumentation remotely, and it's quite precise in terms of his ability to operate. So wow. It is high tech. It's something that I could not have imagined in my career.
Yeah, it is. If you look at what we would look at as like science fiction, oh wow effect on this is pretty huge. As a surgeon, how does this assist the doctor? Why is this such a big deal?
Well, there's a number of reasons. For me, I'm a urologic surgeon, so we operate on kidneys, and we operate in the prostate, which is in the pelvis of the patient's body. And it allows us to get into these locations, these sort of remote locations, without having to make giant incisions. And the other aspect of it is that the instrumentation is so much superior compared to what we've had in the past. The actual movement of the surgical instruments is quite precise and very intricate and delicate. So what we can do is very, very well controlled.
When we look at the olden days, and we all had friends playing football, at least in our age group, any knee injury, anything like that, you ended up with the old zipper, and the scars were pretty traumatic. And this goes back to the 70s and maybe like 80s or so. It's also remarkable how much that has advanced. When you say it laparoscopically?
Laparoscopically.
Tell me what that means.
It means that we put a telescope into the patient's, for example, into their abdomen, and with the small fiber optic telescope, we're able to see the entire operating field versus having to make, like you said, a big zipper or giant incision. So that's really the difference.
Now, let's talk about expenses and supporting this program and where that money comes from.
Well, the money comes from the hospital, and fortunately, we had we have a great administration, and we have a great board of trustees at our hospital. We're unique in that we have a hospital that is controlled by a board of trustees that are members of the community, and so. Unlike many hospitals in Los Angeles and in other areas that are controlled by corporate entities, our hospital really is a community-owned entity. And because of that, it allows us to expand on some of these programs. Gary Wild, who's the CEO of the hospital, saw the importance of this program and really backed us and helped start the program. There were other people that were involved, myself, other surgeons that helped, start the program. And since that time, it's expanded tremendously and gone from really just from urology and general surgery. Now we have a very active program in gynecologic surgery. There's interest in thoracic surgery. And so the program has grown by leaps and bounds. The first year we probably did 50 cases. Now we're averaging 300 cases a year. And I expect by the time the new hospital that we were talking about before, by the time that opens, we'll probably have another robot, and our program will even be larger.
That's pretty amazing. Rich, I'd like to do doctor does not have headphones on. I will interpret.
Well, first of all, what you mentioned some, but what are some of the types of surgery beyond the types that he mentioned that this handles?
So other types of surgeries that can be handled. When we get into it, is this going to help cancer patients in the long run?
Oh, yeah, absolutely. We treat cancer patients almost on a daily basis, both in general surgery, gynecology, and urology. In my practice, with myself and my partner Mo Kadami, we do robotic prostatectomies and robotic nephrectomies and other complex surgical procedures such as reconstructive surgery. We have a very active gynecologic program where they do surgery for gynecologic surgery, and of course general surgery is the same. So all areas are covered.
Can this mean same-day surgery in some cases?
Same-day surgeries is robotic surgery, if we may say, more immediate, more rapid?
Patients, for example, with a radical prostatectomy, patients tended to be in the hospital from 3 to 5 days. Mm-hmm. Our average stay is overnight in the hospital, and there are places that actually do a lot of these operations as outpatients or overnight stays in a overnight hospital type of situation. But yes, I think that more and more operations will be done as outpatients.
Now, looking at this incredible expansion of the hospital, where did you get your education? Where are you from?
I went to medical school in Omaha, Nebraska at Creighton University, and I went to Loma Linda University and did a 6-year residency in urology there. And
as a youth, were you a native Californian?
Yeah, I grew up in Santa Monica.
Oh, you did? So you know why people would want to come out here. You know, surgeons from around the world would probably look at a hospital like this as it's expanding as definitely a go-to place. Live in a community like this and a great facility.
Well, certainly, as we mentioned before, between Los Angeles and San Francisco, I think we've become a regional center of excellence for minimally invasive surgery and robotics, and I think our plan is to help continue that concept. So patients no longer have to go to UCLA or USC for much of their surgery.
You hear a lot of people, they do have to travel and they do have to get out here. And do we have a date on this? I know you are a doctor here, you're not doing the construction, but do we have dates coming up here when we're going to really begin using the facilities?
You mean the new hospital?
Yeah, the new hospital specifically.
I believe that the target date is September 2015 is the target date for the opening. Of course, there's always delays that occur along the road. I think realistically, the new hospital probably will open at the first of the year 2016.
Maybe
probably.
We need robot construction people.
Well,
something like that.
Rain and other things have caused delays, but the hospital, as you've seen, is moving along at a rapid pace, and I think it's going to become a beacon for healthcare in Ventura County.
Rich, anything else as far as questions to the doctor goes?
Well, just one thing, surgeons are taught a certain way, and now this has come along to change that. What is the psychology of it for surgeons who have learned one way, and now this is a whole different way?
That is a great question. So people who have been schooled, old school doctors, if you will, and now new teaching in medical school with robotic surgery, that's got to change the game quite a bit.
Most people that are coming out now actually are really well trained robotically. I was trained laparoscopically, so the conversion from laparoscopic to robotic surgery wasn't too great. We have a tremendous number of general surgeons that are extremely well trained laparoscopic surgeons. They made that transition to robotic surgery quite easily. It's actually, in my opinion, easier to do robotic surgery than it is to do laparoscopic surgery. And actually, there was an article discussing that recently, and the question was, why do robotics when you can do laparoscopic surgery? And the reason is the things we talked about before: better precision, better visualization, better instrumentation.
So it's your knowledge, education, and schooling that allows you to control this precise instrument.
Right.
As the tools get better, the mind and skills of the surgeon is what is going to execute with these greater tools.
Absolutely. It's not like the patient's going to go into a room and like you said, RTD2 is going to take over. It really is dependent on the surgeon's training and ability to proceed through the procedure. So the operations are really the same. It's just the way that the operations are done.
Okay.
Is the surgeon standing over the patient, or is the patient there alone?
Now, you could literally control. A surgeon in New York could do a surgery in Ventura? Right?
That's true, actually, and the reason that this technology was developed was really for battlefield surgery. The concept was that patients at remote sites could be in the battlefield, and technicians could put the instrumentations in the patients, and then the surgeon from a remote location would do the surgery. That has not really developed to the point where the concept was, but that was the idea originally. Correct.
Wow. Well, if you look at what they did in Vietnam with field doctors really doing some pretty intense work under fire,
right.
That was one of the reasons why we saved so many fighting men and women back
exactly.
then. That is, I will just say in my, that's crazy. But I mean, it's just brilliant what they've come up with. That is really something else. Doctor, thank you so much for coming in. Anything else that the audience should know?
Yes, we're going to be giving a talk at CMH on August 19th, and anybody that's interested is welcome to come. You can either look it up on the website, www.cmhshealth.org, or you can call 800-838-8006, and it should be an interesting evening.
So that was 800-838-8006, and people could really, in person with this tour, get a good idea of what's going on with this robotic surgery.
Correct.
Oh, that's great. Thank you so much, Doctor, for coming in this morning. I know you're very busy. 800-838-8006. I'm thinking robotic morning radio. Yeah, so who knows?
There you go.
It could come up. Doctor, again, thank you so much for coming in, and we'll get a lot of people out to this. Again, that is August 19th, 800-838-8006 if you want to get involved.
Or they can look it up on the CMH website.
Okay, and we'll take a look, and we'll post that on our Facebook page. Once again, Doctor, have a great morning. Thank you so much for coming in. We are News Talk 1590 KVTA.